Borno State Governor Professor Babagana Umar Zulum is a man whose humanistic approach to governance is all too apparent. His approach has always been to put the people first.
We have no option because our farmlands were destroyed. The means of livelihood of the entire communities were destroyed. So the only way we can do is to provide humanitarian support. This is the cardinal objective of my administration. In addition to providing security, which is number one duty of any administration, my next ambition is to help the vulnerables in the society. Almost everybody is vulnerable in Borno State. It will last for throughout my tenure of the next 4 years.
Providing needs of local communities, giving them the necessities of life like quality education and health care. In the first 100 days of his second term, the governor focused on primary health care delivery, among other deliverables. He established and constructed 4 primary health centers, each of them with 30-bed capacity. These primary health centers are located in Limankara, in Gwoza local government area, Kaleri in Mafa local government area, Zamari in Konduga local government area, and Shuari 2 in Maiduguri Municipal Council. The primary health center in Shuari 2 was inaugurated by Vice President Kashim Shettima on Friday, the 8th of September 2023.
To cherish forever to commission this training for its service to humanity.
The Vice President congratulated Governor Umar Zulum for the feat achieved in just 100 days of his second term.
And all these things were done in the first 100 days.
Yes, sir. It's a big facility.
The Nigerian number 2 man undertook a tour of the facilities at the health center before leaving the area.
It's a very good market, strategic market.
The next day, I returned to the Shuari 2 Primary Health Center to get a clearer view of the facility, especially its inner recesses. I was received by the Executive Secretary, Borno State Primary Health Care Development Agency, Professor Muhammad Arab Alaji. Professor Alaji is a pediatrician by training, a former Chief Medical Director of the Borno State Health Management Board, and immediate past Commissioner for Health and Human Services in the state.
His Excellency Professor Babagana Umar Zulum has a great passion for health. Again, we all know health is wealth. And the bulk, the majority of the populace stay in the community where you find the less privileged people in the society. And therefore, primary healthcare services is the foundation for any healthcare services, because it's the first contact of the community. The less privileged, the poor, the rich, wherever that is community, their first point is the community. And it is now part of the universal health coverage to ensure that primary healthcare are well equipped, well staffed to offer the services. Because by the time you fix the primary healthcare services in the community, you are now reducing the burden in the secondary healthcare facility and by extension, the tertiary healthcare facilities.
He took me inside the health center and spoke on its capacity to deliver on its mandate.
Government has provided solar power energy, so we are well lit. You can see the panels, everything is white. So we have, one is electricity. Secondly, water supply. You can see we have solar-driven as well as generated-backed water supply. Yes. So water is critical. We have community health officer. Then you needed one. Because we're in the community, so we're dealing with the community. So because these are well-trained with the people in the community. You needed 4 nurses or midwives. You needed 4 senior community healthcare extension workers, we call it S2. You needed 6 community healthcare extension workers, S2. You needed pharmacy technicians because they are also trained in drugs and drugs related. If you don't have the pharmacies, here we have pharmacy technician too. You have medical laboratory technician. These are also trained for laboratory taking of blood, testing the blood level, and so on and so forth.
To ensure that critical health professionals attached to the health center are always available to provide service, Governor Umara Zulum constructed staff quarters for nurses within the premises of the Shuari 2 Primary Health Center.
We have the double the toilets, and they have a quite vast land, for 2-bedroom.
He throws more light on why Professor Zulum is so committed to primary health care delivery.
His vision is to see that in any community you find yourself, healthcare services are accessible, available, accessible, and affordable. And in that line, he ensures that in every political ward, there should be a functional primary healthcare services.
That is his mission.
That is his mission, as also this is the guideline even for the national and globally too. Okay. So in that regard, his real concern is to ensure that the primary healthcare services are really well positioned. So now, because of his passion, he has given the health sector, particularly the primary health care center, a great concern to ensure that a woman at any point in time should be able to avail, a child should be able to, an elderly should be able to come to a primary health care within the shortest possible time to access services. The critical area.
He noted that the governor's unusual commitment to primary health care delivery is already yielding dividends, with Borno State adjudged the best in Nigeria in primary health care and winning the sum of $1.2 million for achieving the feat.
Because of His Excellency Professor Babagana Umara Zulum's commitment and political will and support to the healthcare services, healthcare sector, particularly the primary healthcare services. This has earned us an award which was competed by all the 36 states of the country. This is what is called Primary Healthcare Leadership Challenge Fund. This is a fund that is supported by Melinda and Bill Gates Foundation, by Dangote Foundation, by the UNICEF, Federal Ministry of Health, and National Primary Care Development Agency. There are independent verification committee that visited all the 36, including the FCT, to assess the primary healthcare services. We have 13 thematic areas to be assessed, and one of which is governance and leadership. They also look at it critically, how the political commitment by His Excellency in this regard. And that translated in the provision of these facilities, infrastructure, manpower, drugs and consumable, and so on and so forth. After the verification committee met, they assessed all these 13 thematic areas. And at the end of it, Borno State was adjudged to be the overall best state that is supporting primary healthcare services in the whole of the country. And we were awarded $1.2 million US. First, regionally, in the Northeast, we were awarded 500,000. And after that, all the other 6 zones competed again. And again, we became an overall. That also earned us 700,000 US. I mean, 700, yeah. So together we had 1.2. Yeah. So as it is now,
You are the best.
we are the overall best in terms of primary health care services in the whole of the country.
Nothing illustrates Governor Zulum's commitment to taking healthcare delivery to the door of the underprivileged than the construction of the 44-bed Gwange Maternity Hospital. Professor of Gynecology and Obstetrics, Professor Obaka Ali Kulima, is the Chief Medical Director, Borno State Hospital Management Board. He explains why it was necessary to set up the hospital in one of Maiduguri's most densely populated wards.
This hospital was built about a year ago by His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulum, particularly to address the critical need for pregnant mothers who are accessing health care elsewhere. And then the basis is to make sure that healthcare services are available at the doorstep of the population. And Gwange is one of the strategic wards in Maiduguri that is having the large population of our pregnant mothers who are going elsewhere to access health services. So in view of this, he feels there is the need for him to establish this hospital, particularly to address the care, not only establishing, but he wants to make sure that it is also accessible, and he converted this hospital to be free. They are now rendering free services. As at last year, 2022, they have almost about 5,000 deliveries. About 5,000 deliveries. And that means if you come and see here, women are accessing almost about more than 100 are coming here to book for antenatal care services virtually every day. And then last year we recorded a total of 5,000 deliveries. And so the justification for establishing this facility is strongly justified. And I think kudos should go to His Excellency for having the wisdom to establish this facility here.
Last year, the new hospital recorded about 5,000 births without a single reported death of an inmate during childbirth. I spoke with 2 health professionals who expressed their joy at delivering medical services to an impressive number of patients.
It is only maternity cases are admitted here. That is from 4 months upward. We used to conduct more than 10 deliveries per day. We used to conduct the delivery, and Alhamdulillah, we used to conduct it successfully.
Because it's free service, more people are coming because they are rendering free service for them. Even the people, they are, more especially on Mondays is our booking day. You will see a lot of patients here. Some they will even come and we are liking, sometimes card will be short for them. We are even encouraging the HMBs to add more antenatal card for them because we are having a lot of patients because this place is very populated area. So even them, they are too happy. With this economic, when we give them the free service, them too, they will be appreciated. They will invite more patients here so that we are getting enough data here.
Falmata Kachala, a healthcare professional with 28 years experience, is the Chief Nursing Officer of Gwange Maternity Hospital. She throws more light on what makes Gwange Maternity Hospital unique.
This hospital is free maternal. It's free. People come from far away. They come to this hospital, they attend their antenatal clean free, their routine drugs free, their delivery successfully free. We conduct more than 150 at the month, excessive delivery. At time of antenatal, We attend more than 800 to 900 patients come to clinic and attend their antenatal. Our CMD come and review the theater. They want to expand the theater, and we started operating the theater. Most of the cases here is maternal cases. We have our photograph. You know, photograph is the chart. Once a patient came in, if it's 4 cm, we start to charting that photograph. If the patient going through complication, we immediately have our ambulance, we refer the patient to the general hospital to expert management.
Yet, the governor is not relenting in planning big for the state health sector that already boasts of 41 general hospitals. Along the highway to Damaturu, the Yobe state capital, Governor Zulum is building a 400-bed Borno State University Teaching Hospital and Medical College. I was accompanied to the site of the sprawling teaching hospital by Professor Babamalam Ghana, a UK-trained professor of urology who left his medical practice in Wales, United Kingdom, to take up appointment as Borno State Commissioner for Health and Human Services. He speaks on Governor Zulum's commitment to improving healthcare delivery in the state and what drives the governor's passion.
Excellency has got a very soft spot for healthcare, and he felt that healthcare in Borno State should go sky high, sky being the limit. Yes. And as a result of this, we have got 41 secondary care facilities, general hospitals, but we lacked, state government lacked a tertiary center of this magnanimity, stature. Yes. So as a result of which this was conceived, planned, and a lot of money has gone into this. It's going to be a tertiary center with all the facilities, all the departments you can think of in a hospital tertiary center, and also all the cutting-edge technology, such as CT scans, such as MRI scans, such as mammograms, such as bone scans, such as X-ray machines, such as intensive care units, such as operating rooms, and even the accident emergency department has its own theater. So if someone is in accident emergency, can easily be taken into theater if the need arises. And there's also X-ray facilities within the accident emergency department. So it's cutting edge for what you're seeing or witnessing right now.
He also spoke on his envisaged capacity and when the building project is likely to be put to bed.
The intention of His Excellency Professor Babagana Umara Zulum, the Executive Governor of Borno, is that by next year, middle of next year, this project should be commissioned. And so all hands are on deck right now. And a lot of the materials have been ordered, including the MRIs and the CT scans, and everything have been ordered. And this would be delivered in the next 3 or 4 months. And the roofing will commence next week. And the windows and tiles have all been ordered. So there's a beehive of activities if we had come here early in the morning, as the number of people working on this project.
Professor Ghana is of the view that a project of this magnitude can help reduce medical tourism to the barest minimum.
What we have done in Borno, including setting up this, will reverse the trend of medical tourism, because we're putting in cutting-edge technology here, and we're going to bring clinicians who have the expertise, who understand cutting-edge technology, and who can be able to operate on patients. And this will be done on clinical governance basis, so that cases of mismanagement, misdiagnosis will be in the barest minimum in this setup. And of course, we also have the the University Teaching Hospital here in Maiduguri, which is also running on its own. And therefore, with this and other complementary tertiary centers within the state, within Maiduguri, we will be able to attract the best of brains from all over the world, so that once we put our heads together, we can be able to solve the problems of our people, not only locally, but also attracting people from outside the state who can benefit from the pool of knowledge, expertise, and technology which are available within Maiduguri, and in particular this state teaching hospital.
Among the 9 bills recently worked on by the Borno State House of Assembly are bills meant to catalyze significant improvement in the health sector of the state. The Commissioner throws some light on those bills and why they became necessary.
One of the most important bills that His Excellency has signed into law recently as part of his 100 days celebration in the second tenure is the Drugs and Consumables Supply Agency. Now, until now, the drugs are purchased, from companies, sometimes within town or outside town. But with the advent of this bill, we're looking at the state government pioneering and having relationship with drug manufacturers within Nigeria. We have already contacted at least 5 of them, and they are willing to be able to partner with us so that drugs are manufactured locally and are sourced locally, and we are buying them from a sure source. And we are, in that way, then we eliminate or bring it barest minimum the fake drug syndrome, where you think you are giving a patient drug, but it's not actually drugs. They are, some powder made somewhere. And also, this will bring about, the out-of-stock syndrome, which has existed in our hospitals for many years, where the doctors will just write OS, out of stock, and the patient has to go outside and buy them. So with the Drugs and Medical Supply and Consumables Agency, this will be a thing of the past. And we're very grateful to the State Assembly, who have actually been able to pass this bill into law at a very rapid speed, so that our people, it will bring succor to our people.
In just 100 days of his second term, Governor Zulum executed 77 projects cutting across different sectors. For a man with a people-centered mindset, keeping people alive through qualitative healthcare delivery will always be an overriding desire.